Emma, White House Press Secretary Jen Psaki testing positive for the virus after being fully vaccinated, getting the virus from other household members, according to a statement sent out by the press secretary. Joining us now to discuss is Dr. Frank Contessessa, an internist with Northwell Health. Dr. Frank, thanks so much for coming on. We do appreciate it. Let me get this study out there and get your reaction from the medical world, if I can, Dr. Frank. A new study from the Lancet Infectious Diseases Journal revealing this. People who are vaccinated can spread the Delta variant within their household just as easily as unvaccinated individuals, as you see here. And I quote, fully vaccinated individuals with breakthrough infections have peak viral loads similar to unvaccinated cases and can efficiently transmit infection in household settings, including to fully vaccinated contacts, end quote. As we saw with the press secretary and any major public figure, it's announced when they have COVID-19, obviously fully vaccinated there. But what are your thoughts on that? As we are always told, this is a pandemic of the unvaccinated with this recent study. Is that true?
I have to say it's really not true. I think in my practice, I've seen the same kind of things where I live in a community with a pretty high vaccination rate. And we did have a spike of cases in August and September, mostly Delta variant. Thankfully, the cases were mostly mild, and you tend to see that. Delta does tend to spread a little bit faster than the native variants did initially. So I think it underscores the fact that the vaccines, what they're really good at is preventing serious illness and death. And we should really emphasize getting the at-risk populations vaccinated. I mean, anybody who wants one absolutely should. But the fact that she's doubly vaccinated, fully vaccinated, and still contracted it, I think that underscores the fact that we have to really emphasize the elderly population, underlying conditions, that sort of a thing.
Let me talk to you about the mandates if I can, because essentially that's how a lot of this is being implemented in major cities. The Secretary of Commerce went on the Sunday shows, had this to say about vaccine mandates and getting people back to work. Here's that.
This year, we're on path to have the strongest GDP growth in decades. We had a blip in the third quarter. Why? Delta variant. The quicker everyone gets vaccinated, the better our economy will be back on track, the quicker everybody gets back to work.
But Dr. Frank, this has people confused because once you contract COVID-19, and the study shows you can contract it if you're vaccinated, if you're unvaccinated. So that we know according to that study. And if you contract COVID-19, either way, whatever case you fall on, you have to quarantine. So you're out of work for 10 days. How do you read the U.S. Commerce Secretary in saying delaying the mandates will not work?
I agree with you that it seems counterproductive, doesn't it? The mandates put people out of work. We're seeing it in New York City. The garbage isn't getting picked up. They're closing firehouses. And a lot of these people already had COVID, and they have natural immunity. And we're telling these people, hey, don't come to work. And I think that seems counterproductive. We can continue the efforts, and people who want it should get it. But I think it's counterproductive. I think for her to say that it puts the recovery at risk, I think that's not true. And as we can see, people who have been vaccinated can get it and can spread it. I think we've lost sight of the fact that the vaccine isn't going to end COVID. It's not going to end the pandemic. It will help us save lives. It will help us keep sick people out of the hospital.
I've got to jump in really.
The pandemic.
I agree with you because we've seen the variants and they continue and it continues to mutate. I've got to ask you this really quickly before we go. Moderna, the FDA, saying they need more time to approve the Moderna vaccine for teenagers because of myocarditis, and it may not be available for teens until January. What are your thoughts on this, and how worrisome is it? I got it just maybe 20 seconds for you.
So what happened is the Moderna vaccine, they halted the studies in some European countries, Sweden in particular. I think this emphasizes that we have to be really careful with the vaccines in children. They're at such a low risk. It's the lowest risk population that we have. So we have to really exercise caution on forcing kids to get it. I think we're heading in the wrong direction if we force it on people. Same thing with the elderly. Emphasize kids who have underlying conditions and are at higher risk, because the average healthy kid, this is really not a big risk for them.
Leave it right there. Dr. Frank, we appreciate your time. Thank you so much.
Thanks for having me.